Okay, my name is Kawana Jackson Tarbert. I am a registered nurse and have been so for the last about 30 years, I guess.
Okay, I'm just about to ask you 10 questions.
Okay.
Okay, what made you decide to become a nurse?
Um, Honestly, I get asked that question a lot, and I think nursing has just always been what I've known. I don't ever remember not being wanting to be a nurse. Um, Growing up. So that one is honestly just a hard question for me to answer. Is all I ever wanted to be was a nurse and or a doctor, and I think I went with nursing just because I did have a child young, and I could get to nursing faster than I could get to becoming a doctor.
Okay,
And now that I know what I know, I'm glad I chose nursing.
okay. What type of nursing do you specialize in and why did you choose it?
Okay. I specialize in women's health nursing. And I chose women's health because number one, it just fits. I've tried all types of nursing. I've been med surge, home health. I've done management, education for other nurses, infection control, several different things. Um, I've even done nursing home, hospice, home health, and I started out in labor and delivery doing women's health and just fell in love with it. And currently, I'm a home visit nurse for first time moms. So I kind of take care of moms and babies, but helping women achieve their optimal health, and whether it be through pregnancy or just through their health is just something that's in me. I love seeing women achieve their goals, whether it be with their health or their life goals. So it's just what I love to do.
Okay, what does a typical day at your job looks like?
Um, it kind of depends on the day, but pretty much for the most part, I'm kind of like a nurse case manager slash nurse mentor. I typically spend most of my days in the home with moms that are pregnant and or have had their babies. So I can stay with those moms until their babies turn about 2 years old. At the big when during the pregnancy, if it's a visit where I'm dealing with a pregnant mom, I spend those visits talking to her about her pregnancy health, making sure that she understands the pregnancy itself and that she is having a healthy pregnancy. Then once her baby's born, we continue to focus on her health goals as well as any type of life goals that she has for herself. And then we also focus on the baby, teaching her about milestone development and making sure that the baby is getting off to a healthy start with its life. And then also teaching moms to do those things to help make sure that their child is off to a great start with their life and their education, getting them ready for kindergarten.
Okay, what is the hardest part about being a nurse?
I think the hardest part is realizing that everything can't be fixed by me. Um, I don't necessarily want to fix my clients or fix my patients, but some things I will want for them or want better for them, and sometimes people aren't ready to make those type changes for themselves, such as say someone who may need to lose weight in order to get their blood pressure under control. Sometimes people just aren't ready to make those healthy food choices for whatever reason. It could be financial reasons. It could be they just don't like the taste of certain foods. And but my job is to just teach them the information, and it's up to them to make the changes that they need to make.
Okay, what is the most rewarding part of your job?
The most rewarding part of my job is seeing um, seeing a client slash patient reach the goal that they wanted to reach for themselves, and seeing them be proud of themselves. I also, when I'm working actually as a labor and delivery nurse, I love seeing babies come into the world. It is the highlight of my life. I love being a labor and delivery nurse. Love everything about it. Just love helping a mom do whatever it is that she wants to do while she's in labor, and have that experience that she wants to have.
Okay, what kind of education or training did you need to become a nurse?
I actually had to go to college. I had to make some good grades while I was in high school. Those grades and that education I got in high school was foundational to getting me started with my college education. So I did go to college. There's a number of ways that you can actually become a registered nurse. You can go straight to a 4-year college and obtain a bachelor's degree in nursing, which a bachelor's degree is required for the current role that I'm in. However, you can do stepping stones, which is where you become a licensed practical nurse, also known as an LPN first, and then do what's called bridging to RN. And that way you can start making money a little faster. And then doing that bridge program is you bridge into a 2-year program. So it kind of depends on the route you choose to make and what type of college experience you want. But at least a 2-year degree is required for an associate degree registered nurse, or a BS, or for 4-year degree for a bachelor's degree in nursing.
Okay. Were there any challenges you faced while in nursing school?
Yes. One, keeping my grades up. 2, managing being a mom right into college. So balancing my life goals, and as well as balancing being a new mom and still going to college and obtaining my own goals. And then trying to balance that with taking care of my son. But I did it, so anyone else can do it too.
What skills or qualities are most important for someone who wants to be a nurse?
Skills, I think school will teach you those skills that you need, but qualities, being someone that is willing to listen to others, knowing how to time manage, prioritize. I think compassion is a #1 skill that you need in healthcare, period. If you can't be compassionate or don't want to be compassionate, this may not be for you. I would say it's not for you. As well as, I would say just a willingness to, in nursing, you have to be able to put, during your work, you have to be able to put what you believe in personally aside, because at that moment, it's about the patient or the client that you're dealing with. And what I mean by that is, say, if you have personal issues or concerns with, let's say LGBTQ community, at work is not a time to worry about that. It doesn't matter what that person is coming in for. My personal feelings towards anything has to be put to the side. At that moment, it's just strictly about being a professional and taking care of the professional needs of that individual. Some people have, race issues. You have to put that aside because it is about the person that you are taking care of. Nothing else matters.
Okay. How do you handle stress or difficult situations at work?
Number 1, I prioritize. I try to take care of the thing that is most important first. And then I also make sure that I take care of my own self. When I'm off work, be off work. It's easy for my work to flow into my daily life or not take breaks, or I just make sure that, I do the things that I need to do to decompress, taking care of my mind, my body, my spirit, so that, each day that I walk in, I'm ready to meet those needs. Now, do that mean I don't get stressed out at work? No, it don't. I work with my coworkers as well. I lean on them. We lean on each other for help. nursing is very much a team effort. Without everybody on the team, we can't accomplish a job. So our administrative workers, our housekeepers, our doctors, other nurses, our techs, our nursing assistants, everybody is important. Like everyone is needed to accomplish the goals that we have. And without any of those individuals, it makes for a hard day at work.
Okay, and the last question is, what advice would you give to someone like me who wants to go into nursing?
I would say do it. Go in with an open heart, go in with an open mind. Definitely study. And I would encourage anyone, no matter what field of nursing you want to go into, work at least 1 or 2 years on a medical surgical unit at the hospital prior to going to a specialty unit. A lot of people come straight out of nursing school, go directly to labor and delivery, or go directly to intensive care unit, or go directly to the ER. But a medical surgical unit prepares you for things that it prepares you for all of those places and spaces. Sometimes, people are getting sicker, and medical surgical unit just helps you to understand the basics of taking care of all types of diseases and how each of those different diseases interact in the body and with all the other systems. So, such as I've had, pregnant women come in with health-related issues, health-related concerns, and you can't just ignore those health concerns just because she's there to get a baby out. That baby can still affect her other diseases and processes that are going on in her body, her hypertension, her diabetes. And had I not had that background in medical surgical, it can make for a difficult laboring process, and just not knowing what to do when her blood pressure skyrockets, not necessarily because the pregnancy caused the blood pressure to go up, but because it's a chronic issue that she's had. So I think that's my biggest piece of advice is work med-surg. It's one of the hardest places to work. It's one of the, people consider it the most boring place to work, but it prepares you for all the other places.
Okay, thank you.
You're very welcome.